Signs and symptoms of prostate cancer. Did you know that prostate cancer is the second most common cancer in men worldwide, with an estimated 1.4 million new cases diagnosed each year? In fact, 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Yet, many don't realize they have it until it's too late. So how can you tell if you might be at risk? In this video, we'll explore the signs and symptoms of prostate cancer that every man should be aware of. Understanding these early warning signs could help catch the disease in its earliest and most treatable stages. Prostate cancer can show up in different ways, and knowing what to look for could make all the difference. Stick with us to learn how to protect yourself and be proactive about your health. Ready to begin? Let's take a closer look at what prostate cancer actually is. Prostate cancer develops in the prostate, a small walnut-shaped gland located below the bladder and in front of the rectum in men and people assigned male at birth. This gland plays a key role in secreting fluid that helps keep sperm healthy for conception. Prostate cancer occurs when abnormal cells form and grow in the prostate. While not all abnormal growths are cancerous, some can be malignant and spread to other parts of the body. Early-stage prostate cancer is localized to the prostate, and if caught in this stage, treatment can often eliminate the cancer. However, if the cancer spreads, it can become life-threatening. Prostate cancer is usually categorized into 4 stages, from early stage, which is stages 1 and 2, where it is confined to the prostate, to advanced stages, which is stages 3 and 4, where it may spread to nearby tissues or distant organs like the lymph nodes or bones. Now that we know a bit more about prostate cancer, let's dive into the signs and symptoms you should watch out for. First is frequent urination, or nocturia. One of the most common early symptoms of prostate cancer is frequent urination, especially at night, or nocturia. This occurs because the prostate gland surrounds the urethra, the tube through which urine passes. As the prostate enlarges due to cancer, it can press against the urethra, causing a need to urinate more often. This may disrupt your sleep, forcing you to wake up multiple times throughout the night to use the bathroom. If you're experiencing this, even if it's only occasional, it's important to discuss it with your doctor to rule out prostate issues. Moving forward, you might notice difficulty starting or maintaining urination. Many men with prostate cancer experience difficulty starting or maintaining urination. This happens because cancer, or an enlarged prostate, can obstruct the flow of urine through the urethra, making it harder to initiate the flow or keep it going. You may feel like you need to push to start urinating, or the stream may be weak and intermittent. In some cases, men experience a stop-and-start pattern when urinating. This symptom is also common in benign prostate conditions, but it should still be investigated to rule out prostate cancer or other serious conditions. The next important symptom is weak or interrupted urine flow. A weak or interrupted urine flow can be a significant sign of prostate cancer. As the tumor grows, it may block or compress the urethra, leading to a slow or weak stream of urine. You may notice that the flow starts strong, but weakens or stops abruptly, making it difficult to completely empty your bladder. This symptom is common as the prostate enlarges with age, but when it's paired with other symptoms, it could indicate prostate cancer. Any change in your urinary habits that doesn't improve should prompt a consultation with a healthcare provider. Now, moving on to painful or burning urination. Pain or a burning sensation during urination is another potential symptom of prostate cancer. This discomfort occurs when the cancer spreads to nearby tissues, including the bladder or urethra. The inflammation caused by the cancer can irritate the urinary tract, making urination painful or uncomfortable. Although this symptom is often associated with urinary tract infections, or UTIs, if it's persistent or severe, it could be a sign of prostate cancer. It's crucial to get evaluated by a doctor, especially if you have additional symptoms like blood in the urine or difficulty urinating. Following that, we have blood in the urine, or hematuria. Blood in the urine is one of the more alarming signs of prostate cancer. The presence of pink or red urine indicates hematuria, which occurs when blood leaks into the urinary tract due to tumor growth. Even if there's no pain associated with it, the presence of blood in your urine should always be addressed immediately. Sometimes the blood may only appear once, but it's still crucial to get it evaluated. While hematuria can also be caused by infections or kidney stones, it's important to rule out cancer through diagnostic tests. Another symptom to watch for is pelvic or lower back pain. Pain in the pelvic region or lower back is a common symptom of advanced prostate cancer. As the cancer grows and spreads, it can affect the muscles or bones surrounding the prostate, particularly the lower back, hips, or upper thighs. This type of pain is often persistent and doesn't go away with typical treatments for muscle strain or injury. In some cases, the pain can become more intense and can be accompanied by swelling in the lower extremities. If you experience this type of pain, especially if it's unexplained or doesn't improve, it's essential to see a doctor for further investigation. Up next is erectile dysfunction, or ED. Erectile dysfunction, or ED, or the inability to achieve or maintain an erection, is another symptom that may occur with prostate cancer. As the cancer develops, it can affect the nerves and blood vessels that control erections, making it more difficult for men to achieve or sustain an erection. This symptom can be caused by aging or other health issues, such as diabetes or heart disease. But if it happens alongside other symptoms like urinary changes or pelvic pain, it may indicate prostate cancer. If you're experiencing ED, especially if it's a recent issue, it's important to talk to your healthcare provider. Lastly, we have bone pain or swelling. If prostate cancer spreads beyond the prostate, or it metastasizes, it can move to the bones, causing significant pain. Bone pain, particularly in the lower back, hips, or thighs, can be a sign that cancer has spread. This pain is often persistent and may worsen with movement or pressure. Swelling in the lower extremities, such as the legs or feet, may also occur due to metastasis or because the cancer affects nearby lymph nodes. If you experience unexplained bone pain or swelling, especially with other urinary or sexual symptoms, it's crucial to get checked by a healthcare professional. These symptoms are all potential indicators of prostate cancer, but they can also be caused by other non-cancerous conditions. If you notice any of these signs, it's important to consult a healthcare provider for proper diagnosis and early intervention. So, what exactly causes prostate cancer to form? Prostate cancer begins when cells in the prostate gland develop changes in their DNA. This abnormal DNA causes the cells to grow and divide more quickly than normal. The affected cells continue to live when healthy cells would usually die. Over time, these abnormal cells accumulate, forming a tumor that can invade nearby tissues. Some of these cells may break away and spread to other parts of the body, leading to metastasis. While the exact cause remains unclear, genetic mutations and environmental factors may play a role. Several factors can increase the risk of developing prostate cancer. Age is the most significant risk factor, as the disease is most common in men over 50. Race also plays a role, with Black men being at higher risk, and the disease tends to be more aggressive in this group. A family history of prostate cancer or certain genetic mutations, such as BRCA1 or BRCA2, can also raise the risk. Obesity has been linked to a higher risk and more aggressive forms of the disease, although research results are mixed. While there is no guaranteed way to prevent prostate cancer, there are steps you can take to reduce your risk. Eating a healthy diet rich in fruits, vegetables, and whole grains may help improve overall health and possibly reduce cancer risk. Exercise regularly, aiming for most days of the week to maintain a healthy weight and improve mood. Maintaining a healthy weight is important, as obesity can increase cancer risk. Finally, if you have a high risk, talk to your doctor. Medications like 5-alpha reductase inhibitors may lower risk, though they have potential side effects. And that wraps up our discussion on prostate cancer. Remember, early detection and a healthy lifestyle are key in reducing your risk and managing the disease. If you're concerned about your prostate health, don't hesitate to talk to your doctor and get the right screenings. Stay proactive and take care of your health. If you found this video helpful, be sure to like, share, and subscribe for more health tips. Thanks for watching, and take care of yourself.